Good afternoon. I am Rashi. Today we will be seeing the topic ROSA, that is Rapid Office Strain Assessment. So ROSA, it is a Rapid Office Strain Assessment. So it is a picture-based posture checklist designed to quantify exposure to risk factors in an office work environment. ROSA is modeled after other picture-based checklists and chart scoring systems such as REBA and RULA. The goal of the ROSA process is to serve as a screening tool to identify areas of priority in large office-based organizations. So, the end user will take a paper or the electronic version of the ROSA score sheet with them during an assessment, and the user selects the postures that they observe and record durations that are reported by the person they are assessing. ROSA results. Research has shown a correlation between discomfort levels and increasing ROSA scores. Inter and intra reliability of this assessment score is from good to very good. Scores of greater than 5 are deemed to be high risk and the workstation needs to be assessed further. ROSA methods. The following are the instructions on how to select the postures using the ROSA checklist. A full page example is at the back of this package. Then scoring within the ROSA. Section A consists of the chair height, and the pan depth. So we select the position of the chair height and chair pan, which is appropriate according to the individual. The first position in the left column indicates the neutral position. This corresponds to the score 1. So the knees are at 90 degrees. And the remaining are too low, knee angle is less than 90 degrees. If it is too high, knee angle greater than 90 degrees. No foot contact on the ground, insufficient space under the desk, ability to cross the legs, we score as +1. And additional +1 we give if it is non-adjustable. Accordingly, for pan depth, if it is approximately 3 inches of spaces between the knee and the edge of the seat, if it is too long or if it is too short. The first position in the left column indicates a neutral position and it corresponds to the score 1. Remaining positions are marked with increasing scores. Those sections with scores such as +1, that is insufficient space under the desk, are additive scores. They can be added onto the other scores. For example, if chair height is too high, 2, and if it is non-adjustable, +1, so then the score becomes 3. The score from the chair height is then added to the pan depth to receive the final score from this section, and it will correspond with the vertical axis along the section A scoring chart. So we can see that is the seat pan height is on the vertical axis. So from here, adding both the scores, we will get over here. So the scoring examples: chair height, if it is too low, the height adjustment cylinder is set to its lowest height and the worker is tall. Too high, the knee angle is greater than 90 degrees and there is pressure under the thighs. Too high, but there's no foot contact. Worker is using a stool or a lab height chair, so the feet cannot physically touch the floor. Insufficient space under the desk, so the keyboard tray or the computer tab blocks the leg from moving freely under the desk. If the seat pan depth is too long, there is less than 2 or 3 inches of the space between the knee when the person sits back in the chair. And if the seat pan depth is too short, there is more than 2 to 3 inches of the space between the knee when the person sits back in the chair. So this may focus pressure on the underside of the thigh and the thigh will not be supported. Next comes the armrest and the back support. So select the position of the armrest. Once again, the scores are added on the postures as indicated by +1 in front of the number. And the scores from both armrest section and back section are combined will amount to the scores across the top axis of the scoring chart that is present over here. So for armrest, if the elbows are supported in line with shoulders are relaxed, it is graded as 1. If it is too high and unsupported, so it is 2. If the surface is hard or damaged, then +1. If it is too wide, +1. So these are the additive scores. If there is no adequate lumbar support, chair is reclined between 95 to 110, it is scored as 1. If there's no lumbar support or lumbar support is not positioned in small of the back, so it is scored as 2. Angle too far back, that is greater than 110, or angle too far forward, less than 95 degrees, so it is scored as 2. No back support, that is stool or worker leaning forward, so it is graded as 2. If the work surface is too high, that is the shoulders are shrugged, then it is scored as +1. So addition of both the scores are then represented on the horizontal axis, that is arm and back rest, and a total score is obtained. So the scoring example, armrest. Armrests are too low, so the armrests do not support the forearms with the elbows bent to 90 degrees. Armrest too high, the shoulders are shrugged when the forearm is on the armrest and the elbow is at 90 degrees. Hard or damaged surface, the armrest is made of hard plastic or wood or metal, and this creates a pressure on the forearm. For backrest, no lumbar support. So the chair has a flat backrest, possibly a plastic or the boardroom chair. This is usually seen in less expensive models. The chair may have lumbar support and it is not positioned correctly in the low back. Angle too far back, so the backrest recline is too far back, causing the person to either sit forward or reach to the keyboard. No back support, the worker is using a stool or the backrest is not positioned against the back. So the score from the armrest and back and seat pan and height and depth. So intersection is obtained and the score for section 1 is 4 plus duration is added. So we get the score of 5. So the combined score from arm and backrest section will be compared on horizontal axis against the seat pan depth and height on the vertical axis. The square in which the scores land will then be the score for the chair. To account for the duration that the worker spends in the chair per day, a score of -1 will be assigned if worker spends less than 1 hour a day in the chair throughout the day or less than 30 minutes consecutively. If the worker spends 1 to 4 hours a day intermittently or between 30 hours to 1 hour continuously in the chair, the duration of the score is 0. If worker spends more than 4 hours a day in the chair or greater than 1 hour consecutively, the duration score will be +1. Add the duration score to the chair score to receive the final chair score. So this will represent section A and which will be used later to achieve a final score for the office. Next section comes that is monitor and the telephone. So the scores are related to the monitor position for the worker. With this score, add 1 for the use of the monitor greater than 4 hours per day or 1 hour consecutively. Add a duration score of 0 if it is between 1 to 4 hours intermittently or 30 minutes to 1 hour consecutively. Subtract 1 if there is less than 1 hour of the work done per day intermittently or less than 30 minutes consecutively. This score is then to be used along the horizontal axis. Then select a score related to the position and usage of the telephone. Add in a duration factor of +1, 0 or -1 based on the amount of time the worker spends on the phone per day. This score is then to be used along the vertical axis. Compare the score between the horizontal and vertical axis as done with the chair score, and this score becomes the section B ROSA score, which will be used again later to receive the grand score. So for monitor, we see the arm length distance is, if it is present, that is 40 to 75 centimeters at its screen is at the eye level, then we score as 1. If it is too low, below 30 degrees, it is scored as 2. And if it is too far, then additive point of +1. If it is too high, which is causing neck extension, then we score as 3. If neck twist is occurring greater than +30, then additive +1. Glare on the screen +1. And if there is no document holder, then +1. Then for telephone, if there is headset or one hand on the phone and neutral neck posture, then the score is 1. Too far of reach outside of 30 centimeters, then we score as 2. Neck and shoulder hold +2. So for monitor, it is represented on the horizontal axis, and the phone, the score is represented on the vertical axis. Now the scoring example, monitor. Monitor too low. The top of the screen is 30 degrees below the sitting eye height, causing the neck flexion. Monitor too high. The top of the screen is above the eye level, causing the neck to be extended while viewing the screen. Neck twist. The monitor is positioned to the side of the worker or dual screens may cause the worker to rotate the head back and forth. Document used, no document holder. So the worker has to flex and twist the neck in order to view the papers positioned on the desk. Now, for telephone, if it is too far off the reach, the phone is positioned at the back of the desk, and when it rings, the worker has to extend and bend over the surface to grab the handset. Neck and shoulder hold, the worker has to use the phone and computer at the same time, and in order to type, they will pinch the handset between the neck and the shoulder. Now the section C consists of the mouse and the keyboard. So select a score based on the score of the position of the keyboard. If the keyboard is used for greater than 4 hours per day, intermittently or 1 hour consecutively, use a duration score of +1. For between 1 and 4 hours or 30 minutes to 1 hour consecutively, use a score of 0. For 1 hour or less intermittently or less than 30 minutes consecutively, use a score of -1. Select a score based on the mouse position, and if the mouse is used for greater than 4 hours or 1 hour consecutively, it is scored as +1. For between 1 and 4 hours or 30 minutes to 1 hour, the score is 0. And for 1 hour or less than 30 minutes, a score of -1 is done. Select a score by finding the intersection between the keyboard and the mouse scores. This score will now be used to retrieve a score for the peripherals, monitor, and the telephone. So for keyboard and the mouse, we will score and intersection will be found, and we will get the score for the peripherals and the telephone. Um, Scoring example mouse. Pinch grip on the mouse. The mouse is small, such as a notebook mouse, leading to a pinching of the mouse. Reach to mouse. The mouse is out to the side of the keyboard, causing abduction of the arm. This may be because the person is small through the shoulders, and the numeric keyboard causes further mouse position. Different surfaces. Mouse reach may also be caused if the keyboard tray is too small and the mouse is on the separate surface. Wrist extended. The tray may be angled, or the legs on the back of the keyboard may be up, causing the wrist to be extended while typing. Deviation while typing. A small keyboard can cause the wrist deviation while typing, that is laptop and keyboards. Keyboard tray too high while typing. The shoulders are shrugged in order to rest the arms or hands on the appropriate desk surface. Now, using the score retrieved from the monitor and the phone score in the section B, highlight the correct number on the horizontal axis. Using the correct score retrieved from the monitor and telephone section, highlight the correct number on the vertical axis. Find the corresponding value within the scoring chart. So the value found from this scoring chart will now be used to find the final score by comparing it against the value retrieved from the section A. So this will give, that is the mouse, keyboard, and monitor, telephone, that is, it will give the final score of section B. Now, the score from section A is seen along the vertical axis, and score from B and C is seen along the horizontal axis, which will give us the final score of the ROSA. Then final score is broken into two areas. Further assessment not immediately required, and further assessment required as soon as possible. So if the score is greater than 5, uh, assessment is required as soon as possible. I would like to thank Dr. Parag Sancheti, Manisha ma'am, and Dr. Purva Shimpi sir for giving me this opportunity. I would also like to thank the Physio TV viewers for watching this video. Thank you.